breast augmentation is a procedure that enlarges your breast. So most commonly, we do that with the use of implants, breast implants, which can be silicone, the majority of them, or saline breast implants as well. Some of the augmentations can be done with your own tissue, such as fat. So a fat grafting is an acceptable way to enlarge breasts, although maybe not as dramatically as what you can achieve with a implant. Anybody that has a nice shape and form to their breast and want to enlarge the size, let's say they fit into an A cup size and they want to go to a D cup size, that would be the only way to achieve that would be really with implants. If you were to try to do that with your own fat, you would need quite a bit of fat and more than one episode of surgery to achieve that enlargement. So that's why we resort mostly to silicone breast implants. And the question arises, are silicone breast implants safe implants? And as a matter of fact, they are. In 2006, they were approved for general use by the FDA. And I've been doing a lot of breast augmentation with silicone breast implants, and a great majority of patients are greatly satisfied with that procedure. There's a small number of patients that do have problems with them. Most of them are aesthetic problems. Let's say the breast doesn't look the same after gaining weight, losing weight, or having children. And patient would like to have, in addition to an implant exchange, a lift, something that corrects the shape and form of the breast to match the shape and form of the implant, so you get the best possible aesthetic results. In the year 2006, after 14 years of scrutiny and research, silicone breast implants were brought back to market. And they have been used ever since then. And they're very safe to be used. And but there's a couple of problems that are very concerned about nowadays. And particularly the FDA has required the manufacturers to elaborate a disclaimer that every patient has to read and sign, and I have to co-sign as well. And it's related to two things that are very important. One is the breast implant illness, or breast implant associated illness, which is a disease that is not very qualified or concretely specified, because it presents in different manners, and patients have different symptoms, different constellation of symptoms, and some of those symptoms are fairly vague. For instance, brain fog is one of them, weight loss or weight gain, loss of hair, fatigue is a very common sign. Intense research is being done in the subject to try to qualify or figure out exactly what is going on with those patients. Luckily, they are a very few minority of patients, and some of them have come through my office and I've removed the implants, making those patients feel better. So there is a way to correct this problem, which is to remove the implants. How much needs to be removed, whether there's a need for a capsulectomy or an en bloc resection, those are things that are still controversial. And I think it's very important for the doctor and patient to figure out exactly what is it that we need to do to improve those symptoms. Majority of these patients have had extensive medical workups with no results at all. So everything seems to be normal, but the patient knows that they don't feel normal anymore. So most of the time, we opt for removing the implants because everything else has been tried. The other issue is the ALCL, or BII-ALCL, which is an anaplastic large cell lymphoma. It's a very rare malignancy that presents in some patients that have long-standing breast implants, particularly silicone breast implants and particularly texturized breast implants. So much that Allergan, makers of the natural implant, removed from the market some of those implants that have the texturization that is most aggressive. A lot of people ask me what a breast revision is, and breast revision is nothing more than redoing some surgery. I do that a lot because I do a lot of corrective surgery, but a revision can be anything. It can be just a change of implants, or it can be recutting and redoing the scars, or deeper modifications. So revision just means redoing a surgery that didn't have satisfactory results. Nowadays, I do a lot of corrective breast surgery, which is basically redoing some surgery that was done in the past that either had a bad result or things basically change. People's bodies change a lot in the lapse of 10 or 15 years. I've been in practice nearly 30 years, in private practice. I've been to Oklahoma for more than 30 years. And I have a chance to see some of my patients that I've done 10, 15 years ago and they have changed a lot. And they probably have kids, they breastfed, they gained weight or lost weight or both, and their breasts just don't look the same after that amount of time. So one of the things that I do the most is corrective breast surgery. So those patients go back to surgery. We do generally lifts. We switch the implants, either smaller or larger, whatever the patient wants and is reasonable. And we get very nice results for another 10, 15 more years. So that's one of the most popular procedures I perform nowadays. And if you have any questions about that, feel free to call us so we can arrange for a consultation. Well, the choice of implant size is something very personal. I tend to go with whatever my patients want to do, and so long as it's reasonable, because there are sizes that are a little bit too much for some people, and I will not do anything that I don't think is reasonable. So generally the patient will manifest where are they now, like the cup size they're wearing, and where do they want to be. And sometimes the modification needs to have also a lift or a mastopexy. In this case, we'll restrict it a little bit into how much or how big we can go. Now, if you want to reach a certain size that is a little beyond one surgery, it can be accomplished in 2 surgeries. But nowadays, not very many people want to have more than 1 surgery. So we come to an agreement in which I think that the size the patient is choosing is a reasonable size, and then we can go ahead and proceed with the surgery. Sometimes we're not so sure, so I will have more than 1 set of implants available in case we cannot accomplish the certain size that the patient wants. So I always have to have a backup in case there's not enough room for the desired implant, and therefore we have to go to the next best backup. Okay, the other question I get a lot is how long does it take to recover from surgery? And the answer for that depends on basically what surgery are we doing. So a breast augmentation, a plain breast augmentation, is done through a small incision, and the recovery, so long as the implant is not too large, will be of a few days, 4 or 5 days. Most patients that have an office job can go back in 4 days. Patients that have more physical jobs, it's better for them to wait a full week. But then if we need to do a lift or a mastopexy, which is the same thing, there's going to be more incisions and more surgery involved. So therefore, the recovery is going to be a little longer. It could be a week and a half or maybe even 2 weeks. And sometimes we choose to do more than 1 surgery along with breast. So like, let's say sometimes we do a breast surgery coupled with a tummy tuck. And in that case, the recovery is going to be a little bit more prolonged, like a full 2 weeks or maybe more. So it's good to give yourself enough time to heal. So you would be better off, better results, and you'll have a faster recovery too.